In this video, I will discuss common conditions of the oral cavity. We'll explore 6 prevalent issues that can affect the health of your mouth. Let's begin with Aphthous ulcers. Aphthous ulcers, also known as canker sores, are painful lesions that form on the soft tissues inside the mouth or at the base of the gums. They're typically small and shallow and can make eating and talking quite uncomfortable. These ulcers are non-contagious, meaning they can't be passed from person to person. Several factors can trigger the development of Aphthous ulcers, including emotional stress, minor injuries like cuts, burns, or bites inside the mouth, dental procedures or trauma, aggressive brushing, poorly fitting dentures, genetic predisposition, familial tendency, infection with the herpes simplex virus, or sometimes they can occur for no apparent reason, idiopathic. The duration of Aphthous ulcers is usually around 10 to 14 days, during which time they can be quite painful and irritating. Treatment for Aphthous ulcers typically involves managing symptoms and promoting healing. This can include the use of antibiotics to prevent secondary bacterial infections, analgesics, pain relievers, to reduce discomfort, topical treatments like oral rinses or gels to soothe the lesions, and sometimes a short course of systemic steroids to reduce inflammation and promote healing. If an Aphthous ulcer persists for more than 15 days or becomes chronic or non-healing despite treatment, a biopsy may be recommended to rule out other potential causes or underlying conditions. Next up, we have angular cheilitis. Angular cheilitis, also known as perleche, is a condition characterized by painful, ulcerative lesions at the corners or angles of the mouth. These lesions can cause discomfort, especially when eating or speaking. The causes of angular cheilitis can vary, but deficiencies in certain nutrients such as iron, zinc, and various B vitamins including niacin, B3, riboflavin, B2, and B12 are commonly implicated. Additionally, factors such as low stomach acid and poor nutrition can contribute to the development of angular cheilitis. Avoiding skin irritants like harsh toothpastes, mouthwashes, and spicy foods can help prevent further irritation and worsening of the condition. Treatment for angular cheilitis often involves addressing the underlying nutritional deficiencies through dietary changes and supplementation with vitamins and minerals. A well-balanced diet rich in these nutrients, along with appropriate vitamin supplements, can help alleviate symptoms and promote healing of the lesions. In some cases, topical antifungal or antibacterial creams may be prescribed to treat any secondary infections that may be present. It's important to consult with a healthcare professional for proper diagnosis and treatment of angular cheilitis, especially if it persists or worsens despite home remedies. Moving on to oral submucous fibrosis. Oral submucous fibrosis, OSMF, is a condition characterized by inflammation and progressive fibrosis, formation of scar tissue, in the submucosal tissues of the oral cavity. This condition can lead to various symptoms, including oral burning sensations, marked rigidity of the oral tissues, and eventually, an inability to fully open the mouth, trismus. One characteristic sign of oral submucous fibrosis is the presence of a fibrotic white band that can be observed extending from one pillar of the tonsil to the other. This band represents the fibrotic changes occurring in the affected tissues. The primary cause of oral submucous fibrosis is the habit of chewing areca nut, often in combination with tobacco, which is prevalent in certain regions. Areca nut is also known as supari, and the habit of chewing it along with tobacco is commonly referred to as chalia chewing. It's important to note that the fibrotic changes associated with oral submucous fibrosis are typically permanent, meaning they cannot be reversed once they occur. However, the progression of the disease can be halted by discontinuing the habit of areca nut and tobacco chewing. If the habit is stopped early enough, further progression of the disease may be prevented. Unfortunately, there is no specific cure for oral submucous fibrosis once it has developed. However, early detection and cessation of the habit can prevent further complications. Trismus, inability to fully open the mouth, and the development of oral cancer are 2 serious complications associated with advanced stages of oral submucous fibrosis. Regular monitoring and prompt medical intervention are essential for managing this condition and reducing the risk of complications. Now let's discuss leukoplakia and erythroplakia. Leukoplakia and erythroplakia are both conditions characterized by the presence of abnormal patches on the mucous membranes inside the mouth. Leukoplakia typically presents as thick, white patches, whereas erythroplakia appears as bright red patches. These patches are often painless and can occur on the tongue, gums, inside of the cheeks, or on the floor of the mouth. While leukoplakia and erythroplakia can be caused by irritation or injury to the oral mucosa, they can also be indicators of more serious conditions, including precancerous changes or oral cancer. Risk factors for these conditions include tobacco use, betel nut, also known as gutka addiction, excessive alcohol consumption, and, in some cases, infection with the Epstein-Barr virus. Treatment for leukoplakia and erythroplakia typically involves close monitoring and regular checkups by a healthcare professional, especially if the patches show any signs of change or growth. The most important step in managing these conditions is to eliminate any contributing factors, such as tobacco or alcohol use, as these substances can increase the risk of progression to oral cancer. In some cases, a biopsy may be necessary to evaluate the patches and determine the presence of precancerous or cancerous changes. Depending on the severity of the condition, treatment may involve the removal of the lesions through procedures such as laser therapy or cryotherapy, freezing. Early detection and intervention are crucial for improving outcomes in individuals with leukoplakia and erythroplakia, as they can potentially progress to more advanced stages of oral cancer if left untreated. Therefore, anyone experiencing unusual patches or lesions in their mouth should seek prompt evaluation by a healthcare professional. Another condition we'll cover is oral candidiasis. Oral candidiasis, commonly known as thrush, is a condition caused by an overgrowth of the fungus Candida albicans on the lining of the mouth. While Candida is a normal organism present in the mouth, it can proliferate and lead to symptoms under certain conditions. The characteristic signs of oral candidiasis include the presence of white patches or plaques on the inner cheeks, tongue, roof of the mouth, palate, and throat. These patches may have a cottage cheese-like appearance and can be easily scraped off, leaving behind red and sore areas. Several factors can contribute to the development of oral candidiasis. These include illnesses that weaken the immune system, such as HIV/AIDS, diabetes, or cancer, prolonged use of certain medications like antibiotics or corticosteroids, stress, malnutrition, and conditions that compromise the body's ability to fight infections. Treatment for oral candidiasis typically involves antifungal medications to eliminate the fungus. Neostat drops, which contain the antifungal agent nystatin, are commonly prescribed for oral thrush. In addition to medication, other measures such as rinsing the mouth with a baking soda solution can help alleviate symptoms and promote healing. Addressing the underlying cause of oral candidiasis is also important for successful treatment and prevention of recurrence. This may involve managing underlying medical conditions, adjusting medications if possible, improving nutrition, and reducing stress. Overall, oral candidiasis is a treatable condition, especially when diagnosed early and managed appropriately. However, it's essential to seek medical attention if you suspect you have oral thrush, as untreated thrush can lead to complications, especially in individuals with weakened immune systems. Lastly, we'll explore tongue tie. Tongue tie, medically known as ankyloglossia, is a condition that occurs when the lingual frenulum, the tissue that connects the bottom of the tongue to the floor of the mouth, is unusually short, thick, or tight. This restricts the range of motion of the tongue, which can potentially affect various functions such as feeding, swallowing, and speech. Tongue tie is typically a congenital condition, meaning it is present at birth. While tongue tie itself does not typically affect a child's ability to learn speech, it may lead to difficulties with articulation or pronunciation of certain sounds. The preferred treatment for tongue tie is a procedure called a frenotomy or frenuloplasty, which involves releasing the tight or thick lingual frenulum to improve tongue movement. This can often be done quickly and safely in a healthcare provider's office using sterile scissors or a laser. The timing of the procedure is important, and there is evidence to suggest that performing the procedure early, ideally around 1 year of age or earlier, can help prevent potential issues with feeding and speech development as the child grows. Thanks for watching. Subscribe to our channel MBBS Mastery for more lectures on ENT and other medical topics.